Good morning and welcome to the Pulse of Healthcare. This is Dr. John McCormick. I'm here with Peter, and today we're going to talk about prescription medications. Peter, there's literally no bigger conversation going on in the healthcare space right now at all levels. I mean, even at the congressional level, than prescription medications, cost of prescription medications, adherence to prescription medications, and that's just how it interplays with every element of the healthcare delivery system.
It's, as I've been looking at it and going through some healthcare experiences, I realize that there's a lot of responsibility on the patients themselves with prescription medicine, and I started looking into possible reasons why people wouldn't take it. In your experience, what are you seeing?
Well, there's a lot of things that's going on with prescription medications, right? First of all, when people get prescribed medicines, sometimes they're going to see more than one physician. So they might have a primary care physician, then they have a specialist of some kind, you know, and they may have a couple of different specialists, and they may even have a mental health provider, all of which might be prescribing medications. And because of the way the system's organized, some of these physicians' medications, when they're being prescribed, are not talking to each other. So what you end up with is bad adherence, uh, conflicting medications where you're taking one medication to offset the side effects of another medication, to offset the side effects of another medication. So you end up with a stack of medications. We see people, in their 60s, sometimes 10, 12, 14 medications that they're on. But for efficacy, in other words, will their body actually take in these medications, process them, and use them to make their health better? And the answer to that is the doctors don't know. So it really becomes, oh, we'll try this. Oh, we'll try that. Well, there are some pretty cool tests out there. You can actually do a bio test, and that's one of the things we recommend at Ovation Health, that if you're on multiple medications, that we need to look at that and actually check your biology. And there's some great labs right here in Houston that do this. And they can actually come back and say, of the medications you're taking, only these three work. The other ones don't do anything for you. Your body is actually not processing them. So that's one way that you can kind of get your mind around medications you should take, which kind of leads to the next part, right? Cost, right?
Right.
If I'm on 12 meds, I'm probably spending a lot of money I don't need to spend, especially if only three of them are working, right? So when we look at these things, there's lots of competing factors. So first, let's make sure when you're being prescribed a medication, it's really important that your doctors, all of them, know the entire scope of medications that you're on, right? Because they're kind of the first line. They should be looking at that and saying, and they should know how these medications play with each other, all right? Secondarily, your pharmacist ought to know, all right? So that's your second catch, all right? Now, they're not going to tell you not to take medications because a pharmacist can't do that. They're only going to give you what you're prescribed.
It's interesting. I raise this as a yellow flag to people. If you have older parents, check your parents' medicine cabinets for all the medications there. I actually went through my father's medicine cabinet and found 12 medications, of which 3 of them were duplicates from different doctors.
Right, right. And you don't know if they're taking all three or if they're taking one of the three. A lot of times they'll have forgotten to take their medicine. Let's face it, we have a big dementia problem in our older population. And if they don't have good systems and good support in place, then they're not taking their medications when they're supposed to and how they're supposed to. So sometimes they get pushed to the back of the shelf, they get forgotten about, and then it's like, oh, I'm supposed to take that. And now they've got that duplicate, and now they're taking it twice. So there's all kinds of things you can do that. And there's some pretty easy fixes for that. Dated pill boxes, that are set up either by the family members or through the at-home health providers and things like that to make sure there's adherence. One of the things you can do is set up, alarms and reminders on their phone or their applications. Those are some of the ways that you can help include adherence. And I guess that gets to the point about why is adherence important, right?
Yep.
Why are you taking the meds? So you don't get sick. What happens if you get sick? You end up at the doctor or at the hospital or in the emergency room, right? So the crazy thing is, we know this as a population. We went and got prescribed medication to solve some medical issue that we're having, whether that's high blood pressure or diabetes or any number of things, right? And then 50% of the population doesn't take them.
That is so surprising to me. And then I look back at my previous history when I was going to live forever. I stopped taking all medications. Now I'm back on all the same ones I was on when I was at 30, but bigger health problems because of it.
Right. So sometimes we can exacerbate our own problems by not being adherent.
Right.
Now, we're not saying that, pharmaceutical medications are as end all be all solve everything. Diet, exercise, some of the things that are available through natural medicines and vitamins, huge. And sometimes by doing those things, you can shift away from a pharmaceutical, which is always a desired state. The more we can live naturally, have those kind of things, the better off we are, right?
Right.
Because we never know when we're going to have some kind of catastrophic event in the world, right? And suddenly that medication that you relied on that might have been made in a foreign country is no longer available.
And we have shortages now.
We do. And a lot of the things that are coming out may be because of demand. It could be because of where they're being manufactured or supplied. We hate to say the world is a rough place, and it's not all at peace all the time. And unfortunately, some of these agreements that we have are not always in the best shape.
Right.
So having good physicians that understand that, or they're encouraging you to do natural things to help you manage your work in addition to prescriptions, probably a good path. But let's get back to the medications, because of course, the government thinks they can solve this, and their solve is, well, we'll just limit the amount that you, the member, the receiver, can be charged. Now,
Yep.
That doesn't actually necessarily lower the cost of the medication. It just shifts it. So that means when I reach in my pocket, my copay may be, oh, well, it's insulin. I only can pay $20 now because that's what the government said. Well, they didn't reduce the cost of insulin. They just shifted the cost. So now instead of me, the consumer, paying $50, maybe what I've been paying before, now my insurance carrier or Medicare or Medicaid or whatever other plan is picking up the other cost. So where does that cost go? It doesn't disappear. It goes into your premium. So when we go, oh, our premium went up 20% this year. Well, okay. The government said I could only charge you this amount of money, member, so I did. And then I just shifted the cost back over into your plan, so you're still paying for it, one way or the other. That's one of those, I hate to say, placebo effects where the government, quote unquote, looks like it's doing something positive for the population. But just like taxes and corporate taxes and all those other things, all they're doing is shifting the cost. So we can say, we'll raise corporate taxes and we'll make a lot more tax money. And the corporations go, great, now our products are more expensive.
Exactly. And that the drug companies also do a lot of testing and developing of new drugs, research that takes place. When that go to a fixed cost, that de-incentivizes them to a large extent of not developing new drugs.
Well, as you know, America is one of the leading scientific research and development for new drugs. Most of the new drugs that are coming on the market come through the American system. Unfortunately, that means the Americans are really feeling the brunt of that R&D charge to your. Is that fair? Probably not. Probably not fair that the world gets to benefit from the amount of money that we spend. I can certainly say we overspend for pharmaceuticals without a doubt. Should be some fair sharing, but I can't control that. At the plant level, I can't control that. So let's just tap one more time. We said 50% are adherent, right? So our goal,
Right.
obviously, as a health plan and as advisor to employer groups, is to try to get adherence up. And I kind of ticked off some of the things that can be done. First, analyze and make sure you're only taking the medications that actually work for your body, right?
Right.
Second, we can help manage your pharmaceutical spend. So working with us allows us as at Ovation Health to actually help bring down your pharmaceutical spend. We know that about 10% of the population are really high cost drugs. There are ways through different programs that we have, manufacturer rebate programs that are available, other types of systems that are in place that can actually help the member reduce those costs so they can get access to those pharmaceuticals when they need it. All right. And then the willingness on the part of the member, to not be so caught up in whatever the quote unquote brand name is, right?
Right.
We all know that the pharmaceutical industry spends billions with the B dollars a year for marketing. That's why if you were watching regular TV instead of streaming TV, you would see 3 or 4 commercials per half hour, and they're all sponsored by Pfizer and Moderna. And you're like, they're obviously doing pretty good, obviously making a lot of money. And what are they doing? They're pushing their latest and greatest product on you. Sometimes that latest and greatest product is not materially different than the generic that's been on the market for 40 years that costs 3 cents. But they've made some kind of little biological change in it, repatented it, repackaged it, and now that drug they're charging $900, $2,000 for. So this is where having experts in the field like us, letting us use our coordination, and being open-minded enough to realize that we're not trying to give you less care. We're trying to give you the best care at the best price. So we're going to make sure we go through that process. So cost containment, that's a big deal. If I can afford it, I'm likely to buy it. If I buy it, I'm hopefully going to take it.
It's interesting the pharmaceutical industry pushing the drugs directly onto TV, so people go in and ask their doctor for that drug, not really understanding what the drug does to begin with.
Right.
I mean, it's
I have a lot of conversations with members, and we talk about, I say, did you read the in sleeve? They don't know what that is. And I say, well, that's all the things that the drugs are bad. It tells you all the different side effects that you can have. So that skin irritation or blemish you might be trying to cure by taking a pill, that there might be a cream that you could take. Probably maybe not work as fast, but still works, and the side effects are minimal. Now I'm putting a pill in my body, may work faster, but the damage it could do to my liver and my kidneys, and that's all in the in sleeve, and it is disclosed if you actually read it. So obviously, when you're looking at these pharmaceuticals that are on TV, and you're talking to your doctor about them, we're not saying they're bad. We're saying make sure you understand what all the potential risk and side effects are.
And what it is supposed to do for you.
Yeah, a little cost-benefit analysis might help.
I picked up a prescription yesterday, and I've got a full 8x10 sheet of all the disclaimers and all the things that it does. I'm used to reading those things, and it's still tough to get through.
Right, and so that's another thing. Why people don't take it, fear. So my doctor prescribed it. I didn't want to have a confrontation with my doctor, God forbid, because then he'll yell at me and say, "You're not doing what I said." So I get the medication because they prescribed it, and then I go, because I'm like you, Peter, I read the insulin, and I read it and I go, could shut down my liver, shut down my kidneys, give me a stroke, possible heart attack, I could die. And I'm thinking, I'm just trying to, get rid of a blemish on my skin that doesn't look very nice and may itch sometimes. I think I'm not going to take that. think I'm going to go back to the steroid cream or whatever. But doctors are trying to solve what I'm asking for.
Right.
All right. That doesn't necessarily, I hate to say it, doesn't necessarily mean it's the best solution for me.
Well, that's all they can do is treat you for what you tell them is wrong.
Yeah.
Obviously through a longer relationship with your doctor, the more they know you, the better the complete care is.
And I think so. And that kind of goes back to what I started about. A lot of people have multiple physicians seeing them over because they have different chronic conditions. So that coordination and collaboration of care is so important. Unfortunately, a lot of times that falls back to the member, all right? And that member has to be able to say, hey, doc, I'm also getting meds for from this doc, this from this doc, this from this doc, because those don't necessarily end up in your primary care medical record. So reporting that back so they can help deconflict those things, help give you better cost containment, actual prescriptions that work for you, hopefully that would increase your adherence to taking the medications, because ultimately it's about staying well.
Well, if it works, they're going to take it. If it doesn't work, they're not going to adhere to it.
Right. Or if they have some kind of bad side effect.
Right.
Right. So those are all things that have to be identified, and I'm guilty too. I've taken things and go, that made me sick for like a week. But I didn't go back and run back to my doctor and say, hey, doc, that med you just gave me made me sick for a week. I just quit taking it. Right?
Right, yeah.
So I'm as guilty as the people we're talking about when it comes to these kind of things. So the statistic of 50% doesn't surprise me, even though I know we really should be shooting for 80, 90% compliance. So one of the cool things that we're doing is we actually just partnered with a pharmacy that delivers like 1,000 medications at a fixed rate. So that's one of the ways that we at Ovation Health are going to be addressing cost, and I'm talking about in the very, very near future. In the next 30 to 60 days, we're going to have this product available, not only for our individual policies, but for our group policies. And I hope on one of the next podcasts, I'm going to be able to get the pharmacy manager in here to talk about his program. He's super excited about it. There's nothing like it in the market right now. Literally 1,000 prescriptions available to you, one fixed rate. Doesn't matter if you have one prescription or 10 prescriptions. If they're on the list, they're mail ordered to your house 90 days at a time. I see a potential not only for huge cost savings, but because they're being mail ordered to your house, better adherence. And ultimately, that's what we're trying to get done.
I look forward to having him on the show and learning more.
Absolutely. Well, that's it for this week on Pulse of Healthcare. We'll see you again soon. Take care.